Rabeprazole, also known as Aciphex, is used to treat certain stomach and esophagus problems such as acid reflux and ulcers. It works by reducing the amount of acid produced in the stomach. This medication helps relieve symptoms like heartburn, difficulty swallowing, and cough. It also helps heal acid damage to the stomach and esophagus, prevents ulcers, and may even help prevent cancer of the esophagus. Rabeprazole belongs to a group of drugs called proton pump inhibitors, PPIs. The recommended daily dosage is typically taken once a day, usually before a meal. It's important to take this medication at the same time each day for the best results. Before you start taking Aciphex, make sure to read the medication guide and the patient information leaflet from your pharmacist. If you have any questions, ask your doctor or pharmacist. If you are using the tablets, take your dose by mouth with or without food as directed by your doctor, usually 1 to 2 times daily. Swallow the tablet whole with water. Do not crush, chew, or split the tablet as it can release all of the drug at once, increasing the risk of side effects. For those using the capsules, take the dose 30 minutes before a meal as directed by your doctor, usually once daily. Do not swallow the capsule whole. Open the capsule and sprinkle the contents onto a small amount of soft food or liquid and swallow the entire mixture within 15 minutes of preparing it. The dosage and length of treatment are based on your medical condition and response to treatment. In children, the dosage is also based on weight. If needed, antacids may be taken along with this medication. If you are also taking sucralfate, take Aciphex at least 30 minutes before sucralfate. Use this medication regularly to get the most benefit from it. Take it at the same times each day and continue to take it for the prescribed length of treatment, even if you are feeling better. Tell your doctor if your condition lasts or gets worse, and ask your doctor how long you should take this medication. If you experience a headache that lasts or gets worse, it's important to let your doctor or pharmacist know right away. Remember, your doctor has prescribed this medication because they believe the benefit to you is greater than the risk of side effects. Most people using this medication do not have serious side effects. However, it's important to contact your doctor immediately if you experience any of the following: symptoms of low magnesium blood level, such as muscle spasms, irregular heartbeat, seizures, signs of lupus, such as rash on nose and cheeks, new or worsening joint pain. Rarely, this medication may cause a severe intestinal condition due to a bacteria called C. difficile. This condition may occur during treatment or weeks to months after treatment has stopped. Contact your doctor right away if you experience diarrhea that doesn't stop, abdominal or stomach pain/cramping, blood/mucus in your stool. If you have these symptoms, do not use anti-diarrhea or opioid products because they may make symptoms worse. In some cases, proton pump inhibitors, such as Rabeprazole, have caused vitamin B12 deficiency. Tell your doctor right away if you develop symptoms of vitamin B12 deficiency, such as unusual weakness, sore tongue, or numbness/tingling of the hands/feet, as the risk is increased if the medication is taken every day for a long period of time, 3 years or longer. While a very serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, including fever, swollen lymph nodes, rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing, signs of kidney problems, such as change in the amount of urine. This is not a complete list of possible side effects, so if you notice any other effects, make sure to contact your doctor or pharmacist. Before taking Aciphex, make sure to inform your doctor or pharmacist about any allergies you may have to similar drugs. It's important to also discuss your medical history, especially if you have liver disease or lupus. If you experience symptoms such as heartburn with lightheadedness, sweating, or dizziness, or chest/jaw/arm/shoulder pain with shortness of breath and unusual sweating, seek medical help right away. Additionally, if you experience unexplained weight loss, it's important to consult with your doctor. If you are an older adult, you may be more sensitive to the side effects of Aciphex, such as bone loss and fractures. It's important to talk to your doctor about ways to prevent this, such as taking calcium and vitamin D supplements. For pregnant individuals, Aciphex should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. It's also important to consult with your doctor before breastfeeding, as it is unknown if this medication passes into breast milk and the effects on a nursing infant are still unknown. It's important to be aware of potential drug interactions with Aciphex, as they may change how your medications work or increase your risk for serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Certain products, such as methotrexate, may interact with Aciphex, and it's important to discuss this with your healthcare providers. Additionally, some products need stomach acid to be properly absorbed by the body, and since Aciphex decreases stomach acid, it may change how well these products work. These affected products include medications like ampicillin, atazanavir, and certain antifungals, among others. It's also important to note that Aciphex may interfere with certain lab tests, potentially causing false test results. Be sure to inform lab personnel and all your doctors that you are taking this medication. As always, it's essential to follow your doctor's guidance when it comes to starting, stopping, or changing the dosage of any medicines. If someone has taken too much Aciphex and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It is important to note that Aciphex should not be shared with others. If your doctor prescribes this medication for long-term use, they may also recommend regular lab and/or medical tests, such as magnesium blood tests and checking vitamin B12 levels. It's important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Aciphex, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed one and take the next dose at your regular scheduled time. It's important not to take a double dose to make up for the missed one. It's important to store Aciphex at room temperature, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. Do not flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. When the product is expired or no longer needed, make sure to properly discard it by consulting your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.